Thank you everyone for attending today's Lunch and Learn on time-saving tools in Genie. My name's Alexi Bear and I'm the National Customer Training Manager here at Genie Solutions, a Magenta's company. I'd like to begin today by acknowledging the traditional custodians of the land on which we stand. For me in Perth, this is the Whadjuk people. I'd also like to pay my respects to elders past, present and emerging. Today, we're going to take a look into some of the features available in Genie to save you time during your day. We'll take a look into managing appointments efficiently, then what you can use your quick history and patient list for, how to manage and follow up invoices, take a dive into referrals, go through what macros are and where they can be useful, take a look at Quickscripts, and then finally proceed to templates. At the end of the presentation, we'll have some time to answer any other questions you may have about any of the features I've discussed. If you have any questions, please submit them in the Q&A box at the bottom of your Zoom window, and we'll get through as many of these as we can in that part. Starting off today, a useful function in Genie to turn on, if you haven't already enabled it, is a notification that when a patient books an appointment, Genie will check through for you to check if there's another appointment for this patient in the future and alert you. This is great because let's say a patient booked an appointment with you in 2 months' time. They then call and want to make another appointment for next week. You can inform the patient of their future appointment and work out what's the best course of action for them. Do they actually need it next week or are they happy to wait for the 2 months? To enable this function, we click the Appointments menu and choose Appointment Preferences. Then down the bottom, tick Check for Future Appointments. You can choose between searching from the current date or the date of the new appointment. Usually we recommend choosing New Appointment. When we save out of this window, we can see that Terence has an appointment tomorrow. Now, he might have something to see the doctor about that he couldn't wait until tomorrow, so we're going to squeeze him in for an appointment today. Luckily, we've got a free slot, and so we'll pop him in, but when we try and book it, we get an appointment prompt popping up, warning us about his future appointment and when it is. What do we want to do about the next one? Do we want to delete the future appointment and make the slot free? Delete the future appointment, but keep the type in the diary for that time? Or do we want to keep the next appointment? We're going to choose keep as we want to see Terence both today and tomorrow. The next great feature that you may not know about is copy and paste. So we very often get asked when we're out on site with clients about whether or not it's possible to copy and paste an appointment. And while you can't copy and paste the entire appointment, you can copy and paste the patient name. This is very useful, as if you spend a while flicking between days trying to find the time to book, then by the time you do, you might actually have a mental blank and forget what the patient's name was. So to do this, simply select the appointment and then on Windows, press Control-C. On a Mac, Command-C, just like you would to copy something if you were in Word or another program. Once you've done that, then you just need to go forward and find your new appointment slot that you want to book onto. And use Control-V or Command-V to insert the name of the patient. Hit Enter and confirm that it's correct patient. All booked in without the need to type anything. So now that we can do all of that, how can we actually easily find that next available? This is often an underutilized feature in Genie, and very often we'll see people just clicking back and forth between days or trying to remember when they last booked. So the Find Next Available Appointment option in Genie allows you to quickly and easily find the next free slot in the future with just a few clicks. One prerequisite for this function to work is that you need to be using the appointment schedule or at least blocking out chunks of time in your calendar. So if you're not using the schedule already, you would click the little Rubik's Cube on the bottom left and come in and set it up. You can see I've got consulting set up in my morning. And then click the Rubik's Cube again to bring appointments back. We've got a great article in our knowledge base for this. If I go back to my diary, you'll see I've got this free slot here, but I want to know when the next is. So in my drop down at the top, I'm going to choose consulting. And as soon as I do that, it finds the next available consulting slot for me to be able to book. You can see it found a free slot at 11:45 tomorrow. But if this isn't suitable, we can click find again, and it's going to keep taking us to the next instance. There are some advanced functions you can use when you move the mouse over. You'll notice that tooltip hovered there. So I'm going to choose to use the second one down on that list, the Alt click. This allows me to specify a minimum duration. So for instance, let's put in 30 minutes. And you can see it's skipped past the 15-minute slots and has found the next available 30-minute slot for me. If instead I was to hold this Shift key while I clicked Find Again, this is our advanced search. When we go in here, you'll notice that I can choose my time period, and then under consulting, it's going to show me all of the blank slots so that I can read them off to the patient without having to go back and forth. I can also choose the length required if I wanted a long one, so that I only see slots that have 30 minutes available. Once I've done that, I can then click on the spot that I want. We might go for the 16th of the 8th. It'll take me to that day, ready for me to type in the patient's name and book them in. And then I just need to add any notes and choose what the type is. Following on with the appointment book, we'll come over to our pre-op notifications check. So if your practice does any inpatients or day surgeries, you're probably looking for a way to keep track of things like if they've paid deposits. The pre-op notifications check function might be helpful to streamline these pre-op workflows. It allows you to track on a day-by-day basis which patients have outstanding tasks for their procedures. But one thing to note is that you will need to manually tick the boxes we're about to show you. First, I'm going to show you what we have there able to click. So if we select a patient and their procedure, you'll see we've got 5 tick boxes on the bottom right. If a patient signed their consent, you can tick the first box. If they've paid their prepayment or deposit, you can tick the prepayment received. If the procedure is confirmed, that's what the third box is for. Or if it was a work cover or other third party, you've got the third party box, and your MRSA positive if they were infected with this. If we take a look at our next patient, we've marked the box saying that their prepayment is received. And then our third patient on this list, we can see has actually signed their paperwork. The pre-op notifications check will, for the day you're displaying, show the status of these boxes. So we're going to come to appointments and pre-op. And here we can see exactly what the status is for these patients. We can also tick these boxes from here. And if you need, you do also have boxes to say that the hospital has been notified, the assistant, the anaesthetist, or even the paediatrician. You can use the pre-op notifications check for any surgery day as a replacement for the notes column to keep your appointment book nice and neat and tidy, and to give you a really quick way to reference what's been done and what still needs to be for patient procedures. Not many people use this. It's quite a rare feature, but we do have it, and it's called the theatre list indicator. What the theatre list indicator does is it allows you to see in your appointment diary whether a theatre day is completely booked or whether there's any available slots at a quick glance. First, before we can use this, we do have to enable the setting. So In your appointments menu, we choose appointment preferences again and tick the box for show theatre list indicator. You'll notice a new option has appeared at the top of my appointment book. The status of this tick box will show in the appointment calendar. For tomorrow's theatre day, let's mark it as slots available. You can see once we tick this, if we click off that day, that tomorrow now appears green on our calendar. If we change it to list full, then it now appears as bright pink. When no list is selected, it will show as black, same as all your normal days. So if I go through and mark different days with those different indicator options, you'll be able to see the effect in the diary and on our little minute calendar there. What this allows you to do then is you can choose to book a procedure just by looking at the calendar and seeing all the green days to quickly choose which one to book on, rather than having to click through and try and work out which lists are or aren't full, or even worse, having a paper diary that you're trying to flick through. So if you have lots of theatre days and you're regularly booking some out, this is a great way to be able to quickly see what is available. The quick history. We're moving on to accounts. For anybody who's used this before, it is a very useful tool to see a quick summary of all the items you've invoiced in the past 2 years. This is especially helpful for physicians, as some items like a 133 have a limit on how many times it can be invoiced in the year. Generally, when people want to see what items have been invoiced, they're going to go and take a look at the patient's account history. But to do this, you do need to click on each individual invoice to see the item numbers. Instead, we could access the quick history by selecting the patient, choosing billing, and choosing quick history. Here you can see a summary of all the items, and based on what we can see, an item 110 was billed as the initial consult, so we know that our next item has to be a 116. Being able to do a quick check prior to invoicing will reduce the chance of Medicare exceptions for those items tied to other numbers or for those with a limit on the number of times they can be invoiced. The other useful feature is account types. So account types is quite a well-used feature, but it isn't always used to its full potential. This is very useful in cases where you've got one item number that may have multiple fees charged to the patient. For example, we might have a 104 that's charged at $200 to a private patient or $180 for a pensioner. Or alternatively, you might have 2 or more doctors with different fee schedules. For example, Dr. Smith charges $100 for a 105, while Dr. Demo charges only $80. So how do we use this? To edit the account types, simply go to billing, and at the bottom of the billing menu, you'll see an option for account types. When you click on that, you'll get this little pop-up here. Now, for these account types, you can either double-click on the account type and edit the name. So you might want to change the names of maybe some custom items. Or if you don't have any custom items left and you want to add some new ones, on the right-hand side, you can click Add and create a brand new one. Once you've done this, then within your billing items list, if you go search for example, 104, you can go add in each of the fees for each of these different account types. And that way then, when you're adding a new patient or editing an existing, under the account type dropdown, you can select what the standard fee is for that patient so that each time an invoice is created, the admin team don't need to remember to change it. Let's move on and have a look at the Today's Appointments function. Today's Appointments allows you to quickly display all patients in a patient list who have an appointment today or for a date range. The advantage of this is that all patients can then be sent an SMS or a merged letter in bulk which is very handy if you need to get in touch with them all about something, such as a clinic cancellation. So to access this function, we open the patient list. At the top of the menus, we click Patients and choose today's appointment from the list. Now, as mentioned earlier, it will default to today, but you can actually choose any date range you want, and you can also choose a specific provider. Let's keep it at today's date, and then all patients who have an appointment today will show. If we were to rerun this function and put a week in, then every patient with an appointment that week will show up. From this list, we could then send an SMS in bulk using the button at the top. We could create a merge letter for all of them as well, using the golden sheets at the top. For example, if the practice is moving to new rooms and you want to be really sure that everyone gets plenty of notice where they need to be going and possibly the new parking situation. This isn't the only thing, though, that we can do in the patient list. There are also some more advanced search functions available in here. When we go to the open menu, Patients, very often practices will just type in the surname or the first name or some other detail that we've got here. But what if we don't know the starting letter of the patient's name? If I know BISA are in the first name, I've tried it, but I've got no matches. If instead we do a search with an @ symbol at the front, you'll see that this time we do find my patient. So the reason we use that @ is because it's a wildcard symbol. Rather than searching for BISA at the start of that name, it's telling Genie to search for those 4 letters in that order anywhere in the first name. So a wildcard search is really useful and can be used in most parts of Genie, provided you know at least something that you're searching for. So what else can we use this patient list for? We can have a look for something to do with consults instead. So if I was to open the consult record of this patient, you'll see that the patient has a presenting concern called knee pain, right up there at the top. And this is populated through the consult node. So if we wanted to investigate how many patients have we had with the presenting concern of knee pain, we could open our patient list and click the consult magnifying glass at the top. The window that appears here is a very powerful one, as it lets you do a lot of searching on a lot of different parts of Genie. It does look a little bit confusing for that reason. For today's presentation, we're just going to go through this example, but if you do find you want upskilling in more advanced searches than we're touching here, then please do get in touch with the training team and they'll be able to give you some more personalised training on this. So we're just going to hit the arrow next to consultation problem and choose problem. Then in the value, we type in knee pain and we click query. So this here are all the patients who've had knee pain as a consultation problem. And we could either give this list to the doctor if they maybe just wondered how many patients they had, or if we've just had some new research done or have a new physio who specialises in knee pain, we might want to reach out to these patients to let them know so that we can better help them. It's not just clinical we can search for easily through here. We can also do some medication searches for patients who've been prescribed a particular medication. To do this, we hit the magnifying glass with the RX above it. And in this, we're going to search by brand name, and we're going to use Panadol as an example. There are other options here that we can include or exclude from our search. But if I click OK, then I can choose which variant of Panadol. And I can see the patient that's been returned. And so if we were to open the clinical record, you can see in my prescriptions list there's Panadol. We can also search instead by generic name. For example, we might use the option of metformin. And when we click OK, you can see we've got 3 patients all on metformin. And if we opened one up, we can see it's down there in their script archive. The next thing we can use Genie for is checking missing invoices. So the Check Missing Invoices report is designed to show all the appointments and procedures for a date range that don't have a matching invoice. This is a great way to ensure that you don't miss out on invoicing for any appointments, as especially for those patients who don't pay upfront, like DVA. It's easy to miss them on a busy consulting day. We often see questions around procedure item numbers as well that get referred back to the doctor before it can be built, and often do get lost in a stack of paperwork if you're quite busy. This report will ensure that you can circle back around and get that invoice submitted. And I recommend running this at the end of each week as a double check, then again at the end of each quarter or end of year as a further check. To run this report, we click Appointments. We choose Check Missing Invoices. We click OK to the prompt, pop in the date range we wish to search upon, and then OK. You can at this point select just one provider if you wanted to. When this pops up, all of the appointments and procedures not yet built will show up. And if we have a look at the top appointment, it's a follow-up. So double-clicking on this will take us to the appointment. And if we check the account history, we can see there's no matching invoice for this appointment at all. So we can now go through and create that invoice so that we don't miss out. If we went back to rerun the Check Missing Invoices report for the same date range, we can also see the unbilled procedures. So these are those ones with the blue background, the same as our appointment types. We can also see an inpatient appointment in beige there. And you'll note that the font color for this record is blue, which on the appointment book usually means that it's been invoiced. But if we double click and take a bit of a closer look in the account history, you'll notice that while there is an invoice, the service date doesn't match that appointment date. Therefore, this is actually missing an invoice, and we want to be doing a bit more further investigation to find out why and whether it should have actually been billed. My favourite report in the appointments menu is actually the Check Forward Referrals. So this point shows you any appointments without a valid referral date, and it's great to run at the end of each week. So we're going to Appointments, choosing Check Forward Referrals, and then popping in our date range. It will default to 2 weeks ahead, and we can choose a specific provider or leave it with all. All of these appointments don't have a valid referral for that date, and we can see the notes typed for the top patient indicate that there's a referral. We can see our second one. Our follow-up in pink doesn't have any notes. So I'd probably want to be contacting that patient to let them know that a new referral is provided and making sure that they bring it so that we don't get those Medicare rejections that we all hate dealing with. Moving on to flagging. So flagging can be used for a lot of different reasons, but the most common is in conjunction with recalls. Using flagging alongside recalls gives you a backup to ensure the patient attends for the recall reason and doesn't get missed out. To use this, in the recall list, you can call the patient, send the patient a letter, or send them an SMS. Then once you've done so, we're going to click our reassign at the top. This will mark the recall as complete. But our next box is where we get the option of whether or not we want to flag them. So we're going to decide to say yes in this case. And we're going to do the same for our next patient on the list as well. Because we want to make sure that we definitely do see them, even if they've booked and then they accidentally cancel or have to cancel for a reason. To view all of these flagged patients, we click the Patients menu, open Patients, click the Patients menu, and then select Flagged Patients. These are the patients who we want to check whether they've presented for their recall. We can open up their clinical record, or we can unflag them from here, and we can also see their next appointment date. If we open the clinical record of a patient who's flagged, so we'll search for one that we know is, we have this alert appear. This is a very useful box because it's asking whether the patient is here for their recall reason or if we would like to leave them flagged to be reminded about it again in the future. If they come back in for an appointment not related to the flagged reason, it also acts as a reminder to the doctor to make sure that that reason is discussed at the same time. We'll move across to Quickscripts, which are designed to quickly prescribe your most common medications along with their dose, the frequency, and the instructions. Quickscripts are accessible using the Quickscript drop-down menu in the clinical window. But to create a Quickscript, we first need to create at least a draft script. To do this, we press the plus sign, and then we'll search for the medication that we'd like to have added. Type in the dose, frequency, and any applicable instructions. And then at the bottom, we're going to click the Add to Quickscript button. Nothing happens, which is completely expected. In this case, we're just going to cancel out. And even though it didn't look like anything was happening, if we check the Quickscript list, you'll see it has now added to the list. If you want to delete anything from this, simply hold Alt and click on it. And then next time you open it, you'll see we'll hold our Alt key and click on that medication. And next time we open it up, it'll be removed from the list. So this is a really handy feature that works on any list within Genie where you can't see a trash can or a delete button. And it's designed so that you can't have just anybody going in and deleting things from the lists unless they know the secret. The final thing we're going to look at today are procedure templates. Procedure templates are used where you commonly do a procedure. It can automatically bring in the procedure name, item numbers, notes, and other fields to cut down on data entry. So to create a procedure template, we're going to first create a new procedure. We're going to type in the name, which could be added to the name menu if we want it. And then we fill in the rest of the template. So any fields that we want can be selected, including the pre-op diagnosis, the post-op diagnosis, indication, and any standard pre-op notes. Fields such as date, time, and fasting aren't going to default to a template because these will change per patient. In the Quotes tab, you can pop in any applicable item numbers. And then across in Op Notes, you can pop in your findings, technique, and post-op. Once you've done that, at the bottom, we'll save the template and give it a name. Then next time we go to create a new procedure for a patient, so we'll book someone else onto this theatre list. All we need to do is click the load template at the bottom, choose our template from the list, and it'll auto-populate all of those details we put in, ready to be made individual for this particular patient.